All right, part 2 of chapter 12. So I want to highlight this slide, and there's going to be a number of slides that have a lot of, written stuff, which may be helpful, but I want you to take a look at this and use this as your picture in your mind for studying the bones. Okay, we're taking a look at the axial skeleton. So the cranium, particularly, is covering your brain. We refer to this whole thing here as your skull. The skull itself has a number of bones. The frontal bone, right? We have the temporal bone. We have the parietal bone. And back here, the occipital bone. Okay, it's all based on the region, right? Front. Temporal, that's your temples, so to speak. Parietal, these big pieces on the side. Let's look at your face. We have cheekbones because of the zygomatic bone. And then we have one movable bone of the skull, and it's your mandible, right? So your lower jaw is the one that moves, mandible. The upper jaw, the maxilla, doesn't move. But essentially, we've got the movement of the mandible up to meet the maxilla so that we can chew. All right, moving down to your rib cage then, you have the hard bone. What they used to just call the breastplate. That is your sternum. So if you needed CPR, unfortunately, a byproduct of really good CPR is breaking ribs. Okay. Hopefully the sternum is not broken, but essentially we're having to push on that sternum to get the heart to retract so that we can manually push the blood through the body in CPR. Then we have our ribs. We have a number of different kinds of ribs. I have not differentiated between floating ribs and true ribs and all the things, but we have our ribs. Men and women have the same number of ribs. Put that out there. And then we take a look at the vertebral column. You've got a number of bones that are just beautifully arranged all the way down your spine. There are some natural curves in our neck and our lower back, which is counterbalanced by a slight curve in our thoracic spine. Okay. Eventually then, we are going to meet up with what we would call the sacrum and the coccyx. So your tailbone proper is the coccyx, but that big bone in really part of your butt, which is also curved, we can sit, be poised, and be balanced, is the sacrum. Okay. The one thing here I think is important to mention is that in newborns, their bones are joined by the fontanelles. So if you've had a child, then you know that. It takes a while for the fontanelles to close, about 12 to 16 months, but usually by 16 months. So, another figure to help you: frontal bone, parietal bone. We have our temporal bone, occipital bone. They're showing another bone here, close to the temples, the sphenoid bone. I'm looking at my notes. I did not put that one on there. A zygomatic, right here, your cheekbones. Of course, your maxilla and your mandible. Okay. So if you go on into principles of anatomy and physiology, you will learn more bones, but essentially the bones of the ocular, the eye sockets and so on. There's a number of bones that are making up the sinuses and so on. Okay, another figure, fully front on. Remember my technique? I teach in the Myra Correctional Facility in the spring semester, and I had all of my students pointing to the parts of their skull and learning the parts, and not a single one of them missed it. So there's something really to be said for learning some structures of the body by finding them on yourself and by practicing it and teaching it to other people. All right, the hyoid bone is interesting to mention because it's not anchored. Excuse me. It's not part of the skull, but it is part of the axial skeleton. Essentially, it is acting as an anchor for our tongue and serves as the attachment for muscles associated with swallowing. So hyoid bone, kind of an interesting thing to throw out there. We see a lot of this in our crime shows. Someone was strangled because they had a broken hyoid bone. It's kind of hard to break the hyoid bone unless, you know, you're being strangled. Okay, the vertebral column. Again, we can see this sort of natural sway or curves in the spine. Now, sometimes as we get older, we get more pronounced curving of these areas. And certainly if you have scoliosis, you have curvature of the spine in a direction that's not the way that it should be. Scoliosis is actually caused by muscles pulling the spine, not by the spine itself having the initial issue. I'm not going to ask you to tell me how many vertebrae are in the cervical spine, but these are the ones of your neck. So you should know cervical relates to neck. Then we have the thoracic. So think about thoracic meaning chest. So this is associated with essentially your chest, but it's on your back. So these are thoracic spine. Then we have lumbar. So a lot of people with back issues will have issues in the lumbar part of the spine. So again, naturally curved. Sometimes we overly curve, you know, having poor posture and sitting poorly on the couch, that kind of thing. And then we terminate our vertebral column in the sacrum, which is this rather large bone, which represents actually fused bones. And then we have the actual coccyx, the tailbone, and this is residual from support we had in utero when we were in our embryonic form, and we actually had a postanal tail. So what's left behind is this little bony prominence called the tailbone, which is made up of more than one bone, so it's 4 fused bones. Again, if you want to pause and look at these, you can. Okay. This is essentially concentrated or specialized figure just of our rib cage. So all that I want you to know is that this is the sternum. It is made up of 2 parts, but that's the sternum, the breastplate. And then we have a number of ribs. You can look at your true ribs, your false ribs. It depends on where it connects. If it connects straight to the sternum, then it's true. If it's connecting by something else to get to the sternum, then it's false. And then we have the floating rib, which is not connected at all. Okay. As far as I'm concerned, there's nothing here to know. We've already covered most of that. Okay, so next we're talking about the bones of our appendicular skeleton. So think about it. So we have to have support for our arms and legs, and that support comes from a girdle. So we have a pectoral girdle, which is made up of bones in your, I'm just going to name the bones, the clavicles and the scapulas of your shoulders. Down below, we have our pelvic bones that are going to form the pelvic girdle, which then is going to support the attachment of the legs. So just kind of think about it, all right? We know that each of these girdles is specialized for the purposes of these appendages. So the pectoral or the shoulder girdle and upper limbs are specialized for flexibility. And I'm going to say it, lots and lots and lots of fine movement. And then the pelvic girdle and lower limbs are specialized for strength. Okay, so pectoral girdle. This is the girdle of your shoulders. Okay, clavicles are collarbones, so they sit here, our upper chest, and then our, of course, shoulder blades on the back. And again, just find these on yourself and name them. There's some other information there if you want it, but let's move on. All right, so we're looking at just one upper appendage. So this looks to be this person's, I think it looks like the right arm. I'm going to go with that. Maybe it's the left arm. Sometimes artists draw these things a little odd, so it's hard to tell what they're showing. So it may not be completely anatomically correct, but anyway, clavicles, of course, scapula in the back. This is your arm bone. Not so funny, the humerus. Okay, and then we have 2 bones of our lower arm, or our lower front appendage. So we have on the thumb side, we have, here we go. We have a bone that radiates. So when you move your thumb in a semicircle, the bone that is tracking with it is the radius. And then on the pinky side, there's a stationary bone, and that's called the ulna. Okay. And then we have our essentially wrist bones, which are the carpals. And in this part of our hand, more or less the palm and the top part of the hand, we have our metacarpals. And they go down into our finger bones, and these are called the phalanges. Okay. So those are all the bones that you need to know of the arm and of the pectoral girdle. Now, if you're wondering when they talk about the funny bone, so about once a month, I'm not even kidding, I probably hit my funny bone. This literally is an exposed nerve. It is the ulnar nerve that's exposed when you slightly bend your elbow and you bonk it on something and you get this shearing pain. It can also just make you feel nauseated immediately. That is not a bone. You've hit the nerve. So where does the name come from? Well, you're hitting the elbow somehow, and the elbow is made up of, well, where the humerus terminates, this upper bone, and then where the radius and ulna meet that humerus. So humerus sounds funny, not spelled the same, but essentially we're hitting that area, so people call it the funny bone. All right, so again, if you like the details, want to take the definitions, you can. Okay. All right, so now we're taking a look at the girdle that's supporting our lower limbs. So our lower limbs are called legs, right? We are bipedal organisms, so we stand on legs, 2 legs. We are not like a dog, which we would say they are quadrupedal. So you talk about front legs and back legs, or front appendages and rear appendages, but our front appendages are arms. Okay, so we have the pelvic girdle. So essentially we have hip bones, and then we have the pelvis. So the pelvis itself is made up of the pelvic girdle, which we'll take a look at. That sacrum, that larger bone, slightly swayed in the butt region, and then it terminates in the tailbone or the coccyx. So what is the function of the pelvic girdle? It bears the weight of the body, protects the organs within the pelvic cavity. So we're really thinking reproductive organs and intestines. And of course, the pelvic girdle is the place of attachment for our legs. All right, so let's take a look. All right, so lots of terminology, but we can take a look at the hip bone. So you have these 2 curvatures of the hip bones, which you can feel when we're trying on clothes, or, we know that our hip bones are there. So that hip bone is actually made up of something called the ilium, which I don't believe I have that on your study guide, but essentially it's the ilium. And then to the front, we have the pubis, and we have the ischium. A little harder to imagine where that's at, but it's essentially in your pelvic region. So we have that both on the right and left side, forming this nice structural area for attachment of our leg muscles. So let's take a look at the leg. Now, just like our arm, the bone in the upper leg is a more massive bone. It's just one bone. It's called the femur. And in the lower leg, just like in the arm, there's 2 bones. There's a bigger one and a smaller one. The bigger one is the tibia. So this makes up your shin. If you've ever had shin splints, then it's really the pain that's associated with those muscles along the tibia. And then we have to the outside, on the outside of our lower legs, we have a fibula, which is a smaller bone. Just like you have an ulna, the ulna is analogous to a tibia in your arm. Fibula is somewhat analogous to the radius in your lower arm, but the fibula doesn't move like our radius does with our thumb. Okay, we take a look at the bones of the ankle. So we have the tarsals. And then we have the foot proper, if you will, the metatarsals, and then your toes are called the phalanges. So not too bad. Again, focus on the study guide and remember the figure in your mind. So we will go on to part 3.